to just raise this voice and encourage every young budding that's coming up to join and through research, let the Prime Minister and Rashtrapati and everybody know that we nurses are contributing through our research, bringing changes in the health society. So, after speaking this thing, I like to stop here. Okay, thank you very much. Sorry, in between I may open my this thing. God bless you. God bless you. Thank you. Thank you. Thank you.
For your welcome speech. Now I take this opportunity to introduce our chief guest and our beloved patron ma'am, Dr. Narula Khanna ma'am. Madam has obtained doctoral degree from CGS Columbia University in New York and USA, and Madam have a 45 plus years of professional experience. Madam have been a TNI branch president overseas, say Canada. Madam was a national TNI representative at the United Nations NGO yearly conferences. Published numerous research articles in referred journals and authored a book of perspectives of nursing in India from 1947 to 2023. Indian nursing leaders residing in India and abroad. Madam is the founder of three Indian nursing societies, that is CNRS, Nursing Honor Society, and Nursing Scholar Society, and patron of four, including NDA. Currently retired Professor Khanna ma'am, and working as a freelance consultant of nursing curriculum. Now I invite Khanna ma'am to inaugural the theme profile of the today's session. Ma'am, you are on. You are there, ma'am, online. Khanna ma'am.
Yes, very good morning to one and all. On behalf of Dr. Narula Khanna ma'am, patron, because as madam is facing difficulties through the Zoom platform, so she has given. So
we can.
she has.
Are you going to read or should I read?
Okay, madam. Okay.
Hello.
Yes, ma'am.
Would you read the message, the speech, or would you like me to read it? Hello.
Please, ma'am. Bimla, ma'am. Binu, sir. Bimla, madam. Is it okay? Okay, no, sir.
Okay.
What did Dr. Khanna tell you to read the message?
Yes, ma'am. She texted us just now, ma'am.
Go ahead, please. Go ahead.
Bimla ma'am, madam texted me to just call Bimla ma'am for my message. She told me, ma'am, actually.
Okay. Can I have the PPT, please? Well, these are some of the thoughts of our leader, our patron, Dr. S. Khanna, and she has put the thoughts in a very skeptical manner. She has defined the word acceleration and says, acceleration, as we all know, is according to Tabor's Medical Dictionary, Nursing Central. May I request the members to mute their... good, thank you. I think all of you have to mute your mic, please. Thank you. So Dr. Khanna has just given the meaning of acceleration of Tabor's dictionary, which says that it is an increase in the speed of an action or function, such as in the rate and velocity for a given unit of time. That means whenever we ask of something to speed up, that's what is called as acceleration. May it be in physics, may it be in any working situation or nursing. This IWD 2025 theme focuses on the need to accelerate action, emphasizes the importance of taking swift and decisive steps to achieve our decided goal. For example, empowered women empower the world. We know it well. Strong women, strong world, no doubt. Equity knows no gender. These are some of the examples she has shared with all of us. In essence, Accelerate Action campaign is a call for urgency, inclusion, and transformative change. It signals that equality cannot wait and that all sectors of society must work together to quicken the pace of progress for women's rights and empowerment. Nursing fraternity needs to have joint forces to tackle with nursing issues of gender equality, women empowerment are few of the examples. Can I have the next slide, please?
Yes, ma'am.
There are reasons of slow action in achieving our set goals, such as slow of economic preparation, political representation, and combating gender-based violence. I think we all are aware of. Somebody's mic is on. Somebody's mic is on. Please switch it off. Thank you. Global setback, lack of inspiration of momentum for change, improper tackling of structural inequalities, lack of focus on impactful solutions, lack of intersectional approach, lack of speed and efficiency in progression. So, in essence, our theme Accelerate Action is a call for urgency, inclusion, and transformative change. Our three nursing stalwart speakers will be addressing the power of women empowerment and nursing in shaping our future of prestigious nursing profession. The second one will talk about government policies for gender equality and focus on eliminating system barrier and biases that prevents women's equality. Well, soak all this knowledge like sponge and get ready yourself for Accelerate Action. She said that she would be joining as soon as she'll be able to connect you. So far, namaskar, and she backs it to MC Muthu sir. Well, she has used certain references which she has shared with you, and that's excellent. Can we go to Dr. Binu Jo?
Yes, ma'am. I'll go through, ma'am.
Back to MC, please.
Yes, ma'am. Thank you, ma'am. Thank you so much, ma'am. Now I take this opportunity to introduce our National President, Dr. Binu, sir. Sir is a gold medalist in MSc Nursing and has obtained doctoral degree. And Sir has a 15 plus years of professional experience. Sir has attended, organized many workshops and conferences. Recent international conference was managed brilliantly with a great success. Sir has published numerous science articles and has authored a nursing textbook on pediatrics. Sir, as last 3 years, he had been working very hard to establish our NSS without his, of implementation of concept. We will not have been sitting her with 1600 plus members and 25 chapters in 24 states. We appreciate his unconditional support and vision of enhancing our mission, which is care for caregiver. Uh, Over to you, sir, for your blessings.
A very good morning to one and all. I'm just a mere simple nurse in front of all the respected dignitaries, the ever smiling madam, Dr. Bimla Kapoor ma'am, Dr. Aisha Qureshi ma'am, and yes, of course, I tell sometimes if a nursing is there, the mother of nursing for me is like Dr. Maya Patlia ma'am, Dr. Smriti ma'am, or all my you means Madhya Pradesh. I have very I worked with Dr. Smriti ma'am. Her energetic way of doing the work, at the same time controlling the faculties and making a very disciplined way of doing things. That was a very tremendous efforts with whom I shared with Dr. Smriti ma'am. So it's really blessings which I have shared with all these memories and all the members. I can see we and Muthu sir are the two males who have joined to this International Women's Day and seeing all the women's pioneers and mentors smiling. Yes, I can only remember we should never forget three M's in our life. One is our mother. Because of that, we are here. So with her, we came to this beautiful world. And the second is our mother India. We should never forget. And of course, our mother institute, where we start this, where we learn this, our basics, our foundations of nursing profession. Yes, I can see Dr. Patran madam has also joined
Oh, good.
the event. So it's happy to see that all of you mentors are there. I am not a person to, I'm blessed to have you all. And because of that, only the Nursing Scholar Society has reached this much heights. And now we are having 2,650 members. It's only because of this, within this short while, we have done this. It's great effort of all of your smiling. You all women are really, we are blessed to have you all. And I am Muthu Arsal, only two here. So we bless you all. We are blessed to have you all in our profession. Thank you and good wishes, advance wishes of Happy Women's Day to all of you. Thank you.
Thank you, sir. Thank you for your kind blessings. This is of history of NSS, how we have started through, and this is the objective of NSS. Now I invite our beloved patron ma'am to for the induction ceremony. Khanna ma'am. Khanna ma'am.
Joined somehow, but again I am not able to see her.
Yes, sir. Just joined madam actually. Again, what happened?
Some network issues are there. Actually, in the settings of the Zoom, we are putting none also, but it automatically goes that US is restricted. So
Yes, sir.
I think some today Zoom, some issues is there happening.
So
Actually, it is coming update. They are updating the Zoom. So you have to just
Yes,
click update. Update
we
now.
did it, madam. I did everything. But then
Yeah.
also, I don't know, some technical issues is there in this Zoom platform.
Yes.
So we is very sorry for that.
sir, madam will join or like we'll wait, like we'll go ahead, sir.
We'll go ahead.
Okay. On behalf of Khanna ma'am,
Hello, hello everyone.
Yeah, madam,
good
sound
morning,
is
ma'am.
coming.
Good
Oh
morning,
my
ma'am.
God, it is between two Joes. You people, I don't know what you did it, but you got me in after an
We were
hour.
trying back.
Oh my
They have done
God.
excellent job.
Oh my gosh. Congratulations to both men, whether it is a Women's Day or not, but we need men along with us. What can I do for you now? I'm here.
Ma'am, I invite you, ma'am, for the induction
Oh,
ceremony, ma'am.
oh, gone again.
Yes, ma'am. Yes, ma'am. Please. Over to you, ma'am.
But I don't have it.
Ma'am,
Joe,
PPT it is visible, ma'am. Is it visible, ma'am?
PPT is
PPT?
here. You can just PPT shared.
can you hear me?
Yes, ma'am. Please go ahead, ma'am.
Again, it is interrupted.
Ma'am, it's audible, ma'am. That PPT is visible, ma'am, for you, ma'am.
Okay, so what you want me to start with?
Yes, ma'am.
Induction?
Induction of Fibonacci. Yes, ma'am.
Okay, all five executives are going to be inducted in our Begonia chapter, and including our one speaker who will be taking our lecture, Professor Dr. Archana induction in Hall of Fame, because she has contributed to our nursing profession a lot, and we will be honored to have her as an associate professor. Next slide, sir.
Yes, ma'am.
The first one, executive, is our Mrs. Gauri Manohar. Gauri madam has submitted her doctoral thesis and waiting for Viva. She has 16 plus years of professional experience in a variety of settings in education, practice, research, and administration. She has attended, participated, presented, and organized many workshops and conferences at national and international levels, in addition to publishing her articles, research articles. She obtained many short-term courses, certificates. Madam Gauriji, you are going to be inducted. Congratulations. And I would like to ask you if you want to say a word or two.
Yeah, thank you
Madam,
so much, ma'am, and good morning, ma'am.
good morning.
It's my pleasure to be associated with such an organization and working under you. It's like a big, very good opportunities we will be getting, and we are always eager to learn new things. So thank you so much, ma'am, for providing us with an opportunity. Once again, thank you, ma'am, and thank you all the team for working hard.
You're welcome, and you will be. Next is our Professor Dr. Sneha Uthamji. Madam has 15 years plus of professional experience in a variety of settings and education, clinical research and administration. And she has been examiner, research committee secretary, and research guide. In addition, she had been organizing workshops and conferences at national and international level. She is member of NSS, SOMI, TNI, INR, SI, etc. She also published couple of research articles, obtained many short-term courses, certificates. Madam, congratulations. And you are also being inducted in the society and in the Hall of Fame. Should we start calling them or just due to wait time, I should continue? Sneha ji, are you there?
Yes, ma'am. Good
Okay.
morning to all of you. Good morning, respected ma'am. Thank you so
Right.
much, ma'am, for giving me that opportunity to being a part of the NSS. And definitely, it will be one of the greatest thing for me to learn the so many things for one of the so many elders with us. Thank you so much, for ma'am, for giving me that opportunity.
Put your belt on to work hard for your chapter. And next is Dr. Shweta Bhaskar ma'am. She has diploma in management in addition to her PhD. 21 years of experience. She has made published so many articles on research, scientific articles. You are being inducted and you are a chairperson of peer review committee. Congratulations for your induction in NSS and in Hall of Fame. Hi, Sweta ji.
Good morning, ma'am. And I would like to give thanks, express my sincere thanks to the NSS team and to Ma'am Khanna Patlia, ma'am, all my mentors. And I would definitely be active in the research work and with the NSS team. What all activities will be having, I'll be taking part. I assure you for that, ma'am. Thank you so much.
Wonderful. Next is our Lubna Rachel Pandey madam, and she has 8+ professional experience. Has worked from staff nurse to our assistant professor job, and madam is inducted also in our Hall of Fame, and she is going to be a person of culture education committee. Congratulations and welcome in NSS family. So, ma'am,
Hello,
Yes,
yes.
ma'am.
good morning, all of you. Thank you so much, ma'am, for introducing me in Hall of Fame. Thanks for giving me this opportunity. I really appreciate your everything for everyone for giving me this opportunity. And my special thanks to Professor Navnita Chris, ma'am, who thinks that I can do all the things like she always mentor me to do in a path that I could do all the things in a right way. So I would really thanks to her for giving me the opportunity. She thinks always about I should do myself in a growing way.
Wonderful. Congratulations. And we hope the same thing. That's the trust we had in our executives first time. Otherwise, I, for 50 years, would go into Hall of Fame without my credentials. I'm having from A&M to PhD, the people who have showed trust and believed us and joined us. And I'm putting first time all executives in Hall of Fame. After the election, they will come through the same line of evaluations and selections. So you people are lucky and we are lucky. Next, Mr. Shailendra Upadhyay ji, MSN, MSW, currently working as an associate professor at BIMT College and has some awards in chess competition in extracurricular activities and second prize in badminton tournament in carom competition. Sir is inducted in Hall of Fame and you are a chairperson of election membership. Thank you for joining us. And we are proud of you that you have been doing a lot of things. Then I am showing it here. So congratulations, sir. Would you like to say a second word or two?
Thank you, ma'am. Good morning, everyone. Thank you, ma'am. For my new responsibility, I'm totally excited about this opportunity and appreciate your continued support as I take on these new challenges. Thank you, ma'am. Special thanks to Navnita, madam. He is encouraging me everything on my path. Thank you, everyone.
Yes, thank you. I'll
Thank
see
you.
you later at over. Thank you. Next is our very valuable, and I'm going to put her details were, but in condensed form. Over 26 years of experience as an educator, administrative researcher, and clinical, awarded by PhD in child health nursing and MPhil in health profession education from DMIHER in 2014. And that is under the guidance of Madam PhD was awarded she's the author of two books, Research Methodology and Child Health Nursing. Madam holds one patent and 12 copyrights. To you, ma'am, published 113 research articles in index journals and has TOTs and trainees of many training programs, and life membership of many organizations, and ad hoc inspector Indian Nursing Council since 2018. Yes, sir. In Maharashtra Nursing Council and in NAEC 2024. Is there any more in that? Or let me say about her and invite her, sir. Madam has been very willing, in spite of her schedule, that okay, I will give 20. That made us that once people make a commitment, they are there. And I'm very thankful to you if I don't get a chance to say to you. And you are being inducted as an associate member in Hall of Fame, but would like to have a full member of President's Circle so you can help us actively in our.
Thank you so much, ma'am. Thank you so much for
And
your blessing like wordings. So I thank you so much, ma'am, for giving the chance to me, for giving the chance to me come with you. Thank you so much, ma'am, for that.
okay, next our oath thing.
Yes.
Okay.
Thank you, ma'am. Thank you, Kanna ma'am, for the introduction of Hall of Fame members. Now I request Dr. Binu sir for conducting society oath.
Just so, yeah. Yes. Okay. Okay. I, Binu Jose, I solemnly pledge my allegiance to the society that I will be abiding the rules and regulations of this honorable society. I will discharge my duties and bear the responsibilities as an office bearer. I will carry out my responsibilities as a life member. I will be a responsible member and not give any statements to media or any groups which will reflect negatively to the society. I will function as a part of the society and not solo to promote my agenda or business. I pledge in front of Almighty and this general body to uphold the nursing professional standards and project the honorable image of my profession. I request members to repeat I do.
I do.
I
Do. I should solemnly.
Mr. Sir.
Yes, sir. Now we will be conducting Hall of Fame. I, Dr. Muthu P, solemnly pledge as an inductee of Hall of Fame.
बात भी सही है फर्स्ट ईयर में ज्यादा ध्यान दो कल मैं एनएम पढ़ा रही तो उनने मेरे को एक बार भी नहीं
Please see that your mic is off. Kindly switch off your mic except the speaker. Thank you so much.
Thank you, ma'am. I, Dr. Muthu, solemnly pledge as an inductee of Hall of Fame of NSS that I will honor and cherish the valuable award by showing my elegance to the society. I will uphold the standards of nursing profession, strive to promote and project the positive image of nursing profession. I will keep my elegance as a life member of this prestigious team. I pledge in front of Almighty to promote and perform my duties as assigned. I do. So next, I invite Dr. Pilot Patron ma'am for 4 achievers felicitated on World Women's Day by Begonia Chapter 9, Indore. Khanna ma'am.
We have 4 distinguished gifts and awards to be given to these following leaders. One, Professor Dr. Maya Patliaji from the Begonia chapter for Lifetime Achievement Award. And second is Professor Dr. Chintamani Chauhanji for her academic excellence. And the third is Mrs. Susan C. Roberts for clinical excellence. And the fourth one is my more favorite when people say, we can do it. And without asking patience, I repeat 10 times or 20 times. Professor or budding transfer leader certificate award. And you want me to their okay, Professor Dr. Maya Patliaji is currently retired, but is Begonia chapter president and actively helping the chapter. Madam has 47.
लाइव चल रहा है इसको प्रोजेक्ट पे दिखाते ना क्या
Pinkesh Kumar, please mute yourself. Please mute yourself, please.
Practice, research, administration, and management. She has actively attended, participated, organized, and conducted many workshops and conferences at state, national, and international levels, and worked as peer reviewer for Chhattisgarh Nursing Review. Life member of TNI, NRSI, SOMI, CMAI, MedSearch Society, NSS, NTAI, etc. Her awards and achievements are in volumes, but to name a few, Florence Nightingale, Shripati Award, Hind Ka Gaurav Award, Best Teacher Award, Indira Gandhi Women's Achievement Award, awards from various NGOs for best services, and many more. Begonia chapter is proud and honored to bestow 2025's Lifetime Achievement Award to Professor Dr. Maya Patliaji. Congratulations, dear Madam Ji. Would you like to say a few words here? Is she here from Kolkata or lost like me? Maya Patliaji. Okay, we can proceed. Dr. Chintamani Chauhan. Madam has 42 plus years of professional experience in a variety of settings, such as education, practice, research, and administration. She has attended, participated, organized many workshops and conferences at state, national, and international level. She had been PhD guide, inspector, examiner, etc. Currently, Madam is working as principal in SAPMS College of Nursing in Indore, MP. She published some research papers which have considerable implications in care of our patients. The Begonia chapter is proud to present Nursing Academic Excellent Award to our Dr. Chintamani Chauhanji. Congratulations, Madam. And if you would say a few words here.
Good morning, madam. Good morning, all of you. Thank you very much. I pay my regards to all dignitaries and dynamic leaders and NSS society members. I am very pleased to see Madam Vimla Kapoor also, since long I could not see her. So I am very happy to see her, and thank you so much, all of you, madam, while recognize me. Thank you so much.
You are welcome. Next is our Mrs. Susan Roberts. Should be with the double R. Madam is currently working as nursing superintendent at Joytram Hospital Research Center, Indore, MP. You're following. Next, my dean, who was Dr. Ukande, one-time student from Ludhiana, and you are in Choi Thram Hospital. Great. She has 15 plus years education experience in a variety of fields, such as education, clinical research, and administration. Madam has postgraduate BSN and MBA degree in addition to many different certificates. The plus point is that she has cleared even licensure examination and CLETs and workload in US and Canada. You will be easily migrated. They will grab you. Actually, I should say, I will grab you. Madam is given Clinical Excellence Award certificates and is inducted in Hall of Fame as an associate member. But lately, I heard, so I will remove associate because she already joined our NSS. Thank you and congratulations, madam. Are you there?
Yes, ma'am.
Okay.
Yeah.
Hmm.
Morning to all. And I thank you all very much for selecting me for this wonderful, prestigious award, ma'am. And it's pleasure being on your board from now onwards. I pledge to be a very honorable, very honored, and very honest nursing professional. And my journey was very tough. Of course, I started as a GNM. From GNM, at the age of 50, I completed my BSc because after my daughter settled in marriage, then I went for BSc. Then I did my MBA, and then till today, I am still studying and learning. My quest for learning has never stopped. So I need all your support and prayers for me. And thank you. At the age of 64, I'm still going well, and I've got 40. I've entered my 46th year of being in this profession, and work with all the stalwarts in nursing. So thank you very much for giving me this opportunity to speak to you all, and I'm very honored to be on the NSS.
Still, you cannot beat me. 85, I'm still here.
Yes, ma'am. Looking at you, and I feel I'm really getting an inspiration that
Good.
yes, we should not we'll die with our boots on.
Okay, talk to you later more. Thank you.
Yes, ma'am. Sure. Thank you. Have a wonderful day, all of you.
Okay. Principal Navita Christ. Professor Navita Christ, working as principal of
Dipansha Kumari, please mute yourself, please. Dipansha Kumari, please.
18 plus years of professional experience in a variety of settings, such as in education, practice, research, and administration. Madam is lifetime member of TNAI, NPI, SOMI, GFNPS, NHS, and NSS, and also at Chaitanya Medicine and Global Foundation Trust membership. She has published 7 scientific papers in Referee Journal. She has attended, participated, organized all these workshops and conferences with all that zest and energy. And that kudos to you, Khushi. My favorite name to call her Khushi. She has been wearing multi-society hats as General Secretary, Vice President, and Founder President. But for NSS patron, she is truly a transformational budding leader who has taken a lead to assist in establishing 3 NSS chapters, not only one. She has got 33 members in President's Circle and has just made tremendous contribution to our society. And now she has promised also the 4th one in Chhattisgarh. That is a challenge. Nothing more pleasure to announce the Begonia Chapter Building Leader Award to our Mrs. Navneet. Congratulations. If you want to say a few words. Is Navneeta there?
She's there, ma'am.
Yeah.
Okay.
Thank you so much, Khanna ma'am, and all NSS leader for this honor and giving me this award in my hand. It make me feel very proud, and this reward definitely I will just try to motivate to Chhattisgarh chapter also, sir, ma'am.
Yes. Thank you.
Thank you so much, ma'am.
Thank you. Next slide, sir.
Thank you, ma'am. Thank you so much, ma'am. Now I take this opportunity to introduce our senior NSS National Advisor and our Iron Lady, ma'am, Professor Dr. Bimla Kapoor, ma'am.
Do you want me to read or you are going to?
Yes, ma'am. If you want, you can read, ma'am.
Because I always find pleasure to introduce my
Yes.
where I get so much inspiration, day or night.
Please,
For
please, you
advice.
can go ahead, ma'am. You can go ahead, ma'am.
I talk to Madam has more than 40 years of professional experience after obtaining her PhD from IGNOU as a chairperson of Education Committee set up by Ministry of Health and Family Welfare, Government of India, which brought glowing results of getting the bill passed into law. And is life member and various nursing societies and consultant to many universities. And she is also joined as honorary patron for senior research. Continuing all this progress. Thank you, ma'am. Recently retired from job, but not from the contributions to the profession. She is our NSS Iron Lady awardee and has a pivotal position of NS Senior Advisor at national level. The list of her awards and achievements throughout her professional journey are numerous, but I would like to share some of them with you all. Achievements and awards include first book author of Psychiatric Nursing 1 and 2, established the Delhi Nursing Council, started many higher nursing degree programs in many countries. Awards include T.K. Adrinwala Prize for Research Excellence in Nursing from Nehru Foundation, India International Friendship Society, Vijay Award, and 50th Anniversary Fellowship of the British Consulate with a Certificate of Excellence for Outstanding Services, Achievements, and Contributions. Inducted in Sigma Theta Tau, I have worked there as the branch president, International Nursing Honor Society, USA. Next slide, sir.
Yes, ma'am.
Okay, so I invite our senior nursing advisor of NSS, Iron Lady, Dr. Professor Bimlaji. All the platform is yours.
Thank you very much, Professor Dr. Sukhanna. It's always a pleasure to be back here because you really rejuvenate, you understand what's happening in the world and what's happening in the country. Well, it gives me a great pride and definitely a pleasure and a big satisfaction to see that all the very, very capable nursing leaders, nursing professionals are present today. And today our number is quite a good one, in spite of being a working time. I can see a large number of nursing professionals have gathered today to celebrate this International Women's Day. I think we have every day a Women's Day, but definitely this is very significant today. I welcome the two men. I think the gender biasness is not there. So, Dr. Binujo, you are a very significant person, and so is Dr. Bhutto with us. I'm also feeling very elated that there has been a very good criteria established to select 6 of our members to to get the award of this International Women's Day 2025. And I feel privileged to announce the names of these 6 very capable members, women members, to get an award 2025 of International Women's Day. The other women, the other nurses are equally capable, but we thought we can go on and on every year with the greatest contributions done by our women candidates. So these are our International Women's Day achievers. So I just announced the name. Can I have the slide, please? Next one.
Yes,
We
ma'am.
have Miss Miss Kaplita Tongam. We also have Professor Dr. S. Vasanta Kumari, Professor Dr. Rupa Verma, Professor Mrs. Krishna Chaudhary, Professor Dr. Saima Habib, and Miss Bipasha Laskar. Congratulations to each one of you. Do you want me to read this? Okay.
Yes,
Let's
yes.
have Kaplita Tongam. She has obtained MSc Nursing degree and has 15 plus years of professional experience and has worked in a variety of settings such as education, practice, research, administration. She's also currently Vice Principal of Nightingale Institute of Nursing, Noida. Very proud to see that. She's a member of various organizations like TNI, SWAMI, NSS, IANN, and Innovative Health Curious. She has attended, participated, organized various workshops and conferences, has made contribution in various books as chapters. She's president, and she's a chapter president and other executive committee members. We welcome her for her contribution in research, and she's our research committee chairperson for NSS Lavender chapter. Very good. Congratulations. She has published extensively. Congratulations to you, Kaplita. Very good to know because I have talked to her personally. We'll invite, maybe, do you have anything to say, Kaplita? Just a few words.
Kaplita ma'am, you are there?
Okay, let's go to the next one and we'll come back.
Yes, ma'am. Yes.
We have with us dear Professor Dr. S. Vasanta Kumari. She has obtained her PhD degree and has professional experience of 28 years plus in clinical setting, education, practice, research, and administration. She has also attended various and conducted many workshops and conferences, written a manual, and authored textbooks and conference books. She has been given many awards, including Outstanding Scientist in Pediatric Nursing International Award, Best Professor Award, Best Teacher Award, Indo-Sri Lankan ESN Award, Dr. A.P. Abdul Kalam's Lifetime Achievement Award, and many more. She is also achiever of Women's World Women Day Award certificate by NSS, which is our body, and we are here for that. Congratulations to you, Vasanta Kumari. Would you like to say a few words?
Ma'am, you are there? Vasanta Kumari ma'am, you are there?
Okay, let's take Dr. Rupa Verma, Professor Dr. Rupa Verma.
Good morning, respected madam.
Yeah, let's go
madam,
back to
it's a great vision of mine because we never forget your book. I completed my BSc nursing from 93 to 97. Without your book, we have not studied psychiatric nursing. So it's a great privilege and honor for me, ma'am. Really, I need to thank NSS for this great opportunity. Our patron madam, respected patron madam, and our founder, president, our Binu sir, and all the respected members. And I really am appreciating all the esteemed stalwarts like you, madam, and others. And also because of your inspiration only today we have achieved so many things. It's because of the inspiration what we got from the people, right people and honest people like you all. We are very much privileged to say that we are a nursing professional because of you only, ma'am. Because, and this is what I think the nature is actually trying to take our nursing to the highest glory. It's because of all of you, and we are following your trails. And thank you once again, ma'am, for this great privilege and honor. I thank patron madam and founder president and other members for this and Begonias chapter. My blessings to all of you. And at this juncture, I wanted to tell I need to take the blessings of my guide, my mother, Dr. Maya Patlia, ma'am. She was my INC guide, and really truly privileged. Thank you so much, ma'am.
Thank you so much, Dr. Vasanta. We have with us Professor Dr. Rupa Verma. She has obtained her PhD and has professional experience of 22 plus years and works in a variety of settings such as education, clinical research, and administration. Very energetic, very pleasant. She has attended and participated, organized many workshops and conferences at state, national, and international level. She is a life member of various organizations, associations like TNEI, NTI, SOMI, NRSI, NSS, Commonwealth Association for Health and Disability, UK, and many more. She has been reviewer, editor, and contributor to many journals and books. Her unwavering contribution to our NSS Society, very true, are worth appreciating. In addition to her numerous awards and appreciation letters, she has been featured in local TV shows and presented our nursing profession with dignity and pride. Congratulations to you, Professor Dr. Rupa Verma. It's a pleasure to listen to you if you have any words to share. Dr. Rupa, are you there?
Yes, madam, I'm here. Good morning, everyone. And It's always a pleasure to be at the platform of NSS. I heartily thank Siu Khanna Madam, Bimla Madam, and all the members who are associated with the jury and who have selected me for this honor. I also take this opportunity to thank Dr. Maya Patlia Madam because I am her student basically, right from UG. And Madam, as it is said that NSS is caring for the caregivers, not only caring but motivating, energizing, and encouraging on every day I can say the activities of NSS is truly inspiring, and it's a pleasure and honor to get associated with Nursing Scholar Society. I'm looking forward to do all what I can do for the society and for everyone as a nursing professional. And I also take this opportunity to congratulate all the women who are present here and who are really truly inspiring and striving towards goal each day, and also to all the men who are supporting them. Thank you. Have a good day, everyone.
Thank you, Rupa. Thanks a lot. We have another awardee, is Professor Mrs. Krishna Chaudhary. She is MSc Nursing in Child Health Nursing and has 16-year plus experience in variety of settings like education, clinical research, and administration. Has attended, participated, and organized, conducted many workshops and conferences. She is also a live member of TNI, NTI, ANI, CNRS, NSS. She has also published many research studies and scientific articles, journals, has filed an Indian patent on neurological assessment device for autism, and has been contributor author to many books. She has got awards and fellowship, including Best Nursing Faculty Award, Young Leader Award. Congratulations to you again, being so young and getting an award on this important day. Krishna, would you like to say one or two words? Krishna,
Yes, ma'am.
are you there?
Good morning. Yes, ma'am. Good morning, ma'am. Good morning, everyone. With heartfelt appreciation, I extend my deepest gratitude to all the stalwarts being present here. And I am very honored to the esteemed selection committee for bestowing me this achievement. I am very much thankful to all of you. And thank you once again for this incredible honor, ma'am. Thank you so much.
Thank you so much, Krishna. Our next awardee is Saima Habib, Professor Dr. Saima Habib. Saima has also obtained her PhD and has 12 years of professional experience in variety of settings such as education, nursing practice, research, and administration. She also has attended many conferences, conducted and participated workshops in many workshops and conferences, also guided research while keeping hands on special nursing skill. She has published her scientific papers extensively and has written numerous newspaper articles. She is life member of many organizations, associations. Congratulations to you, Saima Habib. Would you like to share a few words on such an important day with all of us?
Thank you, madam. Thank you very much. Good morning, Siu Khanna ma'am. First of all, happy Women's Day to all the wonderful women. I'm highly thankful to Siu Khanna ma'am for your leadership role. Binu Joy sir, Aisha ma'am, Bimla ma'am, Alka ma'am, and all other national executive members. I'm also thankful to jury members that you recognized for my work, and I feel privileged for this award. I'm highly thankful to the Nursing Scholar Society of India for awarding me. Thank you very much.
Thank you so much, Saima. Our next awardee is Ms. Bipasha Laskar. Ms. Bipasha Laskar is BSc Nursing and MSc in Social Work degree and has 8+ years of professional experience. She is very active in many NGOs and helping Indian communities in variety of areas such as health, nutrition, rural areas, living people. She is also valuable President Circle Executive member of Tripura State Chapter, who has helped in technology-related issues and has worked very hard to meet the deadlines of our induction PPTs and certificates. Thank you for that. And congratulations for getting this award. We are very proud to award you on this particular day. Would you like to share a few words with us, Bipasa? Is she there with us? No. Okay. Let me thank once more our jury members for doing such wonderful job. Thank you so much. Back to you, Dr. Muthu.
Yes, ma'am. Thank you, ma'am. Thank you so much, ma'am. Now I take this opportunity to introduce our second part of Master of Ceremony, that is Professor Dr. Gauri, ma'am. Madam has already submitted thesis for PhD from SME and Nursing College, MP MSc in year of 2022, and YY is completed. And Madam has completed her PG in OPG Nursing Specialty from Government College of Nursing, Indore, in the year of 2020. And PGDA in Education Administration from Symbiosis College of Distance Learning, Pune, in the year of 2012, and BS UG from Government College of Nursing in the year of 2007. Madam is a life member of TNI, SOMI, NRSA, NSS. And Madam has published 14 research papers and presented many papers in various international national conferences. Madam is a member of editorial board for International Journal of Obstetrics, Perinatal and Neonatal Nursing. Member of reviewer board of the Splendid Journal for improving and enhancing the quality of Splendid journals in the field of nursing. I invite Dr. Ma'am for the second part of Master.
Muthu sir, can you give me 2 minutes, please, before we start?
Please, ma'am, please.
Okay, I'm on. Can you hear me? Hello?
Yes, ma'am. Yes, ma'am.
Yes, ma'am.
Can you hear me? Hello?
Khanna, ma'am.
Yes, ma'am, we can hear you.
But
Yes, ma'am.
I think you have to unmute yourself.
Hello. Anyway.
Hello, madam.
Okay,
Yeah.
I want to say quickly that I welcome Professor Dr. Asha Qureshi ji, who has been our SNT president, and she is, regardless to whether we call her,
खुराना के बाद में कुछ बताई
she will be there.
विपाशा के बाद में कुछ बताया गया उसके स्क्रीनशॉट ली है
Harshit Sachin, please mute yourself, please.
Okay, Muthu sir, and our Alka Tajne, who is our Secretary General. I mean, these people are the pillars. Now Asha ji is working, chairperson of the Advisory National NSS Committee. Is Asha ji there? If you can just say a few words, please.
Yes, please. Yes, I'm here.
Okay. Platform.
Yeah. Thank you, Madam Khanna, for giving me such a responsible position. And I congratulate all the beautiful ladies who are gathered over here and who are induced and awarded in today's ceremony. And you know, the event is organized. Can you unmute? Can you mute yourself, please? There's a lot of disturbance is coming from somewhere. So, in collaboration, Begonia chapter in collaboration with NSS at headquarters, has organized this event, and it's a beautiful event. As per Dr. Khanna, speech in the beginning, she said that it is collective responsibility and initiating action for the women's right, equality, and empowerment. It is not just a responsibility for women. It is a collective responsibility for all of us. We must work together to create a world where the girl can dream big, the women can thrive in all aspects of life, from education to employment, health to leadership. Communities can flourish when women and girls are empowered, and entire communities benefit from it. So we celebrate this Women's Day in advance, though it is on 8th, but it is whole year is of Women's Day celebration. And thank you so much. Dr. Khanna, for giving me this responsible position, and I pledge that I will see to it that whatever I can, do for the society, I will do that. Thank you so much.
You're welcome. Muthu sir, all yours.
Thank you, ma'am. Now I invite Dr. Gauri ma'am for the second part of Master of Ceremony. Over to you, ma'am.
Yeah. Thank you so much, sir. Am I audible? Am I audible?
Yes,
Yes,
ma'am.
madam,
Yes.
you are audible, ma'am.
Yeah. Thank you so much. Hope to get the doctorate degree soon. And since morning, we are indeed very pleased to have very eminent and stalwart personalities with us. And let's begin with our knowledge session. So our first session, moderator for the first session is Professor Dr. Prerna Pandey ma'am. She is the NSS Vice President, Chapter 9, Begonia. So Prerna Pandey ma'am, she is currently working as a professor, principal cum dean at SAIMS College of Nursing, Indore. She is serving as a chairman, Board of Studies and PhD guide at SAIMS University, Indore. She is holding the post of president in Indore chapter, Trained Nurses Association of India, and vice president of MP chapter, Nursing Scholars Society, India. She is also an active member and funder in the Ottawa Hospital Foundation, Canada, for the noble cause of innovative and life-saving treatment. She has been an active member of various professional organizations like NE, NRSI, GNAI, etc. She has presented more than 15 papers in national and international journals, and we are delighted to have you, ma'am, as a moderator. Now, I request moderator, ma'am, to kindly invite our speaker and introduce our speaker, Dr. Shweta Bhoskar, ma'am. Over to you, ma'am.
Hello.
Hello. Yeah, ma'am. Over to you.
It is audible?
Yes, ma'am.
Yeah. Thank you. Thank you so much. So first of all, I invite to Dr. Shweta Bhoskar, madam. First, we will read the biodata of that. Dr. Shweta Bhoskar, Assistant Professor, Government at present in the Government College of Nursing, Indore, Madhya Pradesh. Her educational qualification, professional qualification is BSc Nursing from the Government College of Nursing, MSc Nursing from the Choitram College of Nursing, and Diploma in Hospital Management in the AIIMS, Chennai, with the 70% of the gain June 2005. PhD Nursing from the JJTU, Rajasthan in 2021. Professional certification courses in hospital infection control, IV cannulation, NABH, stress management, and CBT, and counseling, etc. State level training, she is also there in mental, neurological, and substance use disorder. Experience, total experience of the 21 years experience, and clinical experience, 6 years of the bedside clinical experience. Teaching and administration, 15 years of the teaching, private and government sector also there. And membership of the life member, TNI, NRSI, Society, SOMI, Indian Society of Psychiatric Nurses, ISPN, and NNS. So there are so many life memberships she has already got. Publication and achievement, published, presented 14 and more than 14 scientific paper in the national and international journals and conferences. Organized workshop, panel discussion, and conferences. She has been research guide for the undergraduate and postgraduate and PhD program also. She has been resource person in many national and international conference and workshop. Has been an author of the Journal of the Mental Health, Heal Nursing under MPMSU, Jabalpur, MP. Thank you, madam. I would like to invite Dr. Shweta Bhoskar to present and deliver her matter. Thank you.
Thank you so much, Prerna madam. Thank you so much. Can I share my slide?
Yes, ma'am. I'll make a exit. Just a minute. You can share
Yes.
yours. Just see, ma'am.
Yes.
Can share your screen.
Yeah. So the very first requirement in a hospital is that it should do the sick no harm. That quote is given by Florence Nightingale, and Florence Nightingale considered the founder of the modern nursing and was a pioneer researcher and statistician who proved healthcare outcome through her work. A very good morning, one and all present here. And I am Shweta Bhuskar, and I am going to present here a small topic, a small content of the topic. Topic is very vast, but the content I have, because the shortage of time is there. But the topic is really very encouraging for us, especially for women nurses, because we are majority in number. Though the starting of the this thing program is started by 2 men, and I really thank and respect Binu sir and Muthu sir for that. And and we'll start. I'll start my topic: the power of women empowerment and nursing research in shaping the future. So here, the presentation will show how women empowerment and nursing research create a healthier, equitable future. So we see that in current scenario, women in nursing are majority, and nursing is predominantly female profession, but leadership gaps persist only with 23% of hospital CEOs and hospital administration position. Only 23% of women are occupying this position, which is very less, and we should be working on it to get the equitable representation and recognition. So here we see the Indian some statistical data that in India, like more than 35 lakh registered nurses are there. This is the data of 2023, and only 2% of them are engaged in research, basically. And though we know that female nurses are more, and majority of their age group which are involved in nursing care and actively involved in nursing research are 25 to 45 year of age group. And we see that academic qualification in India, that PhDs are like more than 1,500 Indian nurses are holding now PhD degrees in India, and masters, more than 5,000 people, nurses are pursuing master. And there are so many lot of top universities which are really doing a great work toward empowering nurses as leaders, as educators, and in the field of research also. So here we see that more than 2,000 peer-reviewed publications are coming from India annually, and average 8 citations per publications are there. This is the last 10-year data is saying like that, more than 8 citations are there. And there are increasing. Not only in India, we are doing the research, we are collaborating with international team also. So this is an encouragement for all our Indian nurses. And here we see that women empowerment, why we are saying that only nurses can do, only women can do. It is not like that. Actually, women is the like at home also. If women is there, home will be very much tidy and very much disciplined. But if men is there, means it is a really common tendency. And we see also that if women are there, if mother is there, wife is there, sister is there, then home will be very much tidy and organized and systematic. Likewise, nursing also, research also will be systematic and organized if nurses are more contributing towards the research work. So what is women empowerment? So here we say empowerment means having the autonomy, resources, and support to lead effectively. And here we see the key components are there: education, mentorship, leadership training, and supportive work environment as well. And these all things create sound atmosphere, a conducive environment for the nurses, for the women to be effective in nursing profession, and creating a culture, a sound culture, a healthy culture where women's voices are heard and valued. So what is the impact of empowered women on patient care? So there is an enhanced communication and empathy, which leads to improved patient outcome, because women can communicate properly, women are approachable, women can be empathetic and people generally in common way also we have seen that patient, when we are looking when we are giving bedside care, so patient comes to woman nurse only. Mostly it happens because they know that woman will be very much soft. She will respond. She will listen properly. She will listen patiently. So people have the tendency, and it is seen also that women have the good active listening quality also, and empathetic and sympathetic quality also. So there is enhanced communication and empathy, which leads to improved patient outcome. Patient gets benefited, patient gets more information through proper communication with our nurses. And continuity of care, increase job satisfaction and retention among nurses. When we are seeing that if women are given recognition, they work more and more. If we are simply like in charge also is saying, oh, you are doing really good job, that is simple. Trainee nurse also do double job, double work. She does duty in a very effective way. Whenever she will be encouraged by the nurses, by the teacher, by the in charges. So there is a increased job satisfaction when nurses are doing proper. They are getting recognition also, and when through research we get the recognition. And there is a enhanced collaboration, because whenever we are working in team, and we see that there is a positive environment, and when we are getting good responses from our leaders, from our nursing administrators or our teachers or our principal in education side, and in the community side, if we are getting the cooperation, then we work in a more effective way. So here we see in nursing research, some of the technologies have also emerged, which have made it more diverse and more complex also, as at the same time it has made research very simple also. Because before, what was there, only through book, we are going library and we are reading the book, we are taking the notes, we are writing the notes, and then we are typing. Now the things are there, so many e-journals are there, so many e-books are there. Whatever we want to study, we can now we are seeing that even AI and artificial intelligence also have come, ChatGPT has come. So whatever we want to express, that we can modify, we can edit in that ChatGPT also. So here we are seeing that how nursing research is grooming more and more with the technology, like telehealth we are using. And in hospital setting, we are seeing that real-time data also can be collected by the wearable sensors also. And so many data analysis and all interpretation can be done through artificial intelligence also. So what is the role of nursing research? So there are mainly three roles: evidence-based solutions we are getting new perspective for the nursing contribution, and then there is a research, we can make the policy and we can implement those policy into practice for the better healthcare outcome. So what are the areas of research we are generally doing in our healthcare setting. Like we are focusing main researches on chronic diseases. We are focusing more on maternal and child health areas. We are focusing on mental health areas. And we are focusing on current infectious diseases, what are current epidemic or pandemic diseases are there, or any epidemic diseases are there, which is currently at local community level. So we are working on these mainly areas, but we have to work on more and more areas. So these are the areas which we are mainly doing the researches. Now, I would like to quote some of the real success stories to encourage all of us from the foreign. These are the few nurse researchers who are doing research in the field of nursing, like Dr. Patricia Banner. She has currently worked on a theory. She has developed a theory on novice to expert theory in nursing. So she has done a very good study. You can go and Google it, and you can read her story, theory on this thing. This is a real contribution she has done in the field of nursing research. And Dr. Linda Aitken, she is a staff nurse, and she has done a research on staffing pattern, nurse staffing pattern, and the patient outcome. So these are the research, this thing that is showing that how the nurses are doing the very good research in the field of nursing and the field of clinical area, in the field of administration, in the field of education also. And main aim is that to improve the quality of patient care. So in the scenario in India, we are seeing how in community setting or hospital setting, some of the examples I have taken in the slide, like Dr. Sumati Bemizin. And she has done a study on maternal, in the field of maternal child health in 2015, and she has done a study on impact of kangaroo mother care on preterm infant in a tertiary hospital setting. And she has done a study by using the designed randomized control trial, RCT, and she had taken 120 preterm infants and their mother. And through data collection, she had come up with the findings that KMC significantly reduced infant mortality. It also improved weight gain. It also improved weight gain among the preterm infants. Another study was done by Dr. Lata Venkatesan. She has done a study on diabetes management. So here she has done group education sessions and improved counseling in the community level, and home visits also she has done. And she has emphasized that more like culture, according to the culture, according to the nature of the people, according to their habits and their rituals and their tradition, only we have to give education and health education to the people. And she has, her findings were, the study showed improved glycemic control, medication adherence, and lifestyle modification. So what interventions she had done? She had done group education sessions on diabetes management, individual counseling on diet and exercise, home visits for monitoring and support. So tremendous work she has done in 2018 in Tamil Nadu. Another example I want to quote, that Dr. Priya Abraham, she has done in 2020 one study on enhancing pain management. So the key findings were there. She had done some innovative approaches, that interventions she has done. She is also a nurse, and she has done a study on on pain management, and she has done relaxation and pain reduction sessions. She has taken relaxation techniques she has used to relieve the pain, and she has concluded that there is a and also she has added the positive affirmation while she was giving relaxation technique. She had encouraged the patients to say few positive affirmations by yourself, so that the pain will be reduced. So this study was done by her in post-operative ward at CMC Vellore in 2020. And she had found out that there is a significant reduction in pain score and anxiety level as well. So these were the in the clinical setting, what our nurses, researchers are doing is so tremendous job in our India. In college setting also, we are seeing that in a college setting, in a education setting, our nurses are also doing researches, so nice researches we are getting, our results we are getting, and but some challenges are also there, we can see. We'll see later on. So nursing education is the cornerstone of quality healthcare. It prepares nurses for complex roles. So nurse researchers contribute significantly to its advancement. They bring innovation and insight. So some of the scenario I have quoted here to encourage ourselves. Dr. Anjali Sharma in 2018, she has done an innovative simulation-based learning research. She has used the effect of high-fidelity simulation in teaching critical care nursing skills. She has done RCT, randomized controlled trial, in AIIMS, New Delhi. And she had found out that integration of simulation labs across AIIMS nursing programs influencing national curriculum guideline, and she had found out that there is a significant improvement in students' confidence and competence in managing critical care scenarios and reduced error. Error also has reduced significantly by 22%. So she had concluded that there is a simulation method is very effective in teaching. And in the same way, Professor Priya Nair in 2020 from CMC Vellore, she has done a study on M-learning integration. M-learning means mobile learning integration. She has done that through the use of mobile phones or through the use of tablet or mobile phone or laptop. We can improve the learning, teaching learning skill, and we can improve the learning method improve the learning in students. So she has concluded that M-learning increase students' participation by 40% and knowledge retention by 25%. And she has concluded that development of a national M-learning framework. She has recommended that there should be M-learning, means mobile learning framework should be there for nursing education, which should be adopted by Indian Nursing Council. And the same way, Ms. Deepa Patel in 2022, she has done a community-based survey and research study, and that she has done a study on increasing student recruitment from rural areas. And she has done so many surveys and mixed method approach she had used there, and she motivated people there. So many intervention programs she has included in the rural area to motivate the rural girls and students to come up for the nursing profession. And she had found out that community-based education increased student recruitment from rural area, 30% increase was there, improved cultural competency, 20% improvement was there. And she had recommended that this program should be more and more to be implemented in rural areas also, so that our rural community people also get recruited and so get into the profession and get recruited for the betterment of their life. So these are the quotes and examples from the foreign and from India, what I tried to quote here, because I wanted to encourage here that we as a woman, we have the responsibility, accountability to improve our nursing research, to improve our research to the level of excellence that it should be implemented in our practice, it should be implemented in our curriculum, and it should be even given to the students, our new students, our trainees also, so that our profession should be recognized in a whole global area, global world. So what are basic methodologies we can use to improve our nursing research is through RCT we can do. What is RCT? RCT is randomized control trial. So when we are using a randomized control trial, so it has a significant impact on nursing research because it provides a strong evidence. It improves the patient outcome because by rigorous testing interventions, RCTs help identify the most effective treatments and strategies leading to better patient care. And there is advanced nursing education. RCTs contribute to the body of nursing knowledge by generating new insights into disease management, symptom control, and health promotion. It is also a guiding clinical decision making, and it is also helps in enhancing professional credibility, because we are the nurses. People say, doctors say that what nurses will do. Nurses can do so many things because they are only the people who are doing systematic research work. Doctors are doing research, but they don't know the steps. What are the 16, 17 steps of quantitative research? What are the 15 or 16 steps of qualitative research? They don't know the steps, but we are doing everything in a systematic and step-by-step manner. So we know we are following methodology also, we are following all the steps of the basic researches, and so we have the professional credibility if we do it in a scientific way and in a honestly. If we are doing that, we will get the professional credibility also. So RCT provide a powerful tool for nurses to investigate the effectiveness of interventions and improve patient outcomes. They are essential for advancing nursing science and ensuring that nursing practice is based on the best available evidence. So we get recognition also through our researches, and quasi-experimental study also we can do. We can do mixed study also. While I had got this topic of women empowerment, I am really thankful for Patlia madam, because she had given me this topic and she is my mentor and my mother also, and I am really grateful for this. And I'm doing a small study on women nurses empowerment. So a small self-structured rating scale I have made to assess the attitude of nurses and the interviewing method by using open-ended question to get qualitative data from nurses. I am doing the study, it is on the way, but some of the responses I have got is from nurses are time constrained, why they are not able to do their researches, and some doctor dominance is there. Means the doctors are saying, why you are doing, you don't have to do anything, why you are here only for doing a nursing care, you don't have to do any research and all. So people are making the nurses down. So these are the challenges which are facing. And when I'll come with the responses and the result of this small study, I'll really I'll surely present this study because but it is on the way, and some of the themes I am getting through qualitative data that nurses are, because nurses are getting discouraged, their discouragement they are getting from the their team members, from the especially from doctors, and they are thinking that they are only doing very good things, but nurses cannot do. So these are the challenges. and in clinical setting, more and more these challenges we can see. So through mixed study also, we can do more satisfying researches and data collection through all this thing. What are the data collection methods we can apply appropriately? We can do research study. So these are the research methodologies we can do to in a nursing research to get a very good evidence-based practice. So what are the strategies for empowerment? So some of the strategies are there. Why we are doing this women empowerment lecture, and why we are doing, because we have to strengthen. How we will strengthen? We have to strengthen through our education system, through our mentorship program, and through a collaboration with the teamwork, team members. So with that only we can get the empowerment. So some of the technology we already have shared that this thing through e-health, through data analysis, and through online resources, we can enhance our research data. Some of the challenges, but we are seeing in our day-to-day practice, and like I had shared some of my experience through open-ended question, that there is heavy workload, and some of the things we have seen in our past experiences also, that lack of research training in nursing also. If teachers are not robust with the proper methodology and as a mentor, and we are not able to, then we will not be able to give proper teaching, proper content to the students. And because of the lack of training, lack of mentorship, student nurses, they are lacking confidence in doing research. But thanks to our good teachers, because there are so many good teachers are emerging, and they are doing so many, like this type of programs are going on. The NSS also is encouraging for the researchers. NRSI is also encouraging for more and more researchers. So we have to be updated as a nurse, teacher. We have to be updated ourselves, so then we can give good training, good teaching to our students also. And we have to involve them for the small short researches also. Research study also we should encourage them to do. And limited resources are there. There is another problem. Limited funding is there, because research requires resources like funding, equipments, access to database, and research assistants also required to do the at grassroots level. But in India, these challenges are there. But if we really take pain, then we'll get good results. Other barriers are also there, like institutional barriers are there, ethical issues are there, patient privacy and all. These are the issues. Socio-cultural factors are there. And then insufficient mentorship, as I have told, lack of recognition and incentives. Like I was saying, like doctors are saying that we are only the boss, we are the only recognized people, why nurses are doing research. So this is the main discouraging factor, but we should overcome with that, because we have knowledge, we have studied a lot, and our nurses, our mentors are doing so good researches. So we should be motivated, and we should be self-motivated, and we should be doing good researches in the field of nursing, and we should show them that we have the autonomy, we have our own recognition and professionalism. And there are limited collaboration. Collaboration and cooperation is limited. These are the challenges. But what all things we can do to address those challenges? We can make supportive environment. We can make some small team who are having our friends and colleagues who are really interested in research. We can make team of them, and we can do research. A small research we can start, and we can do in a big level also. And we should be updated with research, latest researches also, latest studies also, we should be updated. So some of the challenge recommendations and are there to improve our research challenges. So increase investment in research, for because fund is required, so we should, even our institution also, we can request our principal, our administrator to cooperate and to financially also they can, some of the contribution like our friend circle, our colleague also, we can contribute financially, and we can do research in large level. And as I have told, we should be keep in touch with the good mentors, good guides who can guide us for doing good researches. And we have to collaborate. We have to keep in mind the ethical aspect also. And these whatever results we'll get, we have to translate it, these evidences into practice. For that also, we should be very much requesting and humble to our administration, to our education side, to our practice clinical side also, so that we can get the cooperation from doctors and administrators. So to conclude with, nursing research is the cornerstone of evidence-based practice. So empowered nurses will lead innovation. They will influence policy, invest in research and capacity building, unlock the potential of Indian nurses. And whenever we are doing research, we will be able, we are having potential to build the body of knowledge in a proper way. So we can invest in research more and more. So this will be for our professional development also. So to thank Indian nurse researchers are making significant contributions. Invest in research and support mentorship. Promote collaboration. Recognize the vital role of nurses. They can become global leaders in nursing research. So with humble gratitude, I would say the care of the world is in the hands of women, and the care of women is in the hands of nurses. May your compassion, intelligence, and dedication continue to heal, comfort, and inspire humanity. A very happy Women's Day to one and all. And I would like to give thanks to all mentors, to Khanna Madam and all an NSS team member, Smriti Solomon Madam, for giving me this opportunity. Thank you so much, ma'am. If anybody has any doubt, can you please ask?
Gauri ma'am, you are there?
Yeah, I'm here. Yeah, thank you so much, ma'am. Prerna ma'am.
Hello. Yes.
Yeah, ma'am.
Thank
Over
you.
to you.
Yeah. Thank you so much, Shweta madam. Your session was very attractive, informative, and scientific session was there. That you have already discussed about the power of the women empowerment and nursing research in the shaping the future. First of all, you have to discuss about that the current scenario. That leadership gap, you have already explained that only 70% leadership, it already occupied male and 30% women. So we had to encourage them, motivate them to all women that hold the big post or hold the leadership. After that, shaping of the bright future, she has already discussed about that. And so many researchers, like abroad in India, so many researchers, they have done their research. And after that, it should be there. We had to plan and nursing research, shaping the future. It means we will be a researcher, scientist, advisor, administrator, leader, sponsor. Thank you so much. Very good and attractive.
Thank you, madam. Thank you.
Okay.
May I just add something, please?
Yeah, sure, ma'am.
Well, excellent presentation, Dr. Sweta, and it was really very informative, very good work done. My only information to you, which I want to share, through Clinical Nursing Research Society, CNRS, we have signed an MOU with CAHO, and CAHO is ready to fund us for any research studies, number one. Number two is that if there are certain good research studies, maybe through NSS also, we are planning to do something on funding part, maybe minimal, but some amount. Then there are various other funding agencies which are ready to fund to us so that we can do good research. So we can always explore the possibility for future. And the study which you have taken up and are going to do is also excellent. All the very best. Thank you so much.
Thank you so much, ma'am.
श्वेता बेटा, मैं भी कुछ बोलना मांगती हूँ. गॉड ब्लेस यू और खूब आगे
Thank you.
बढ़ो और इंडिया के नेशनल लेवल पे नर्सेस को रिसर्च करवा के गवर्नमेंट को बताओ हम नर्सेस के लिए क्या क्या करते हैं, है ना. गॉड ब्लेस
जी
यू.
मैडम. Thank you so much, madam.
तो आप कुछ हो. गॉड ब्लेस यू.
Thank you, madam. Thank you, madam.
Thank you so much, ma'am. And thank you, Shweta ma'am and Prerna ma'am, for accepting being as a speaker and moderator. So now we will be moving on towards our second session. And the topic is government policies for gender equality in India. The moderator of the session is our dear Dr. Sneha Yotham ma'am. She is Chair Research Committee, Chapter 9, Begonia, Indore. Just I would like to tell in short about the achievements of Dr. Sneha. She had 15 plus year experience of professional experience in a variety of settings such as education, clinical research and administration. She is the examiner, then research committee secretary, research guide, in addition to organizer of many workshops and conferences at national level. She is an active member of NSS, SOMI, TRAI, NRSI, etc. She also published couple of research articles and she has obtained many short-term courses certificate. So, Sneha ma'am, you are going to be inducted in Hall of Fame. She is today, in fact, inducted in the Hall of Fame as an executive and in the NSS Society. So, congratulations, Sneha ma'am. And I would like to invite Sneha to introduce our speaker to the wonderful audience. Sneha, over to you, ma'am.
Thank you, Gauri ma'am. A very good morning to one and all present over here. It's my privilege and honor to deliver a welcome address of one of our more prestigious and enthusiastic young and dynamic speaker, Dr. Smriti Ji Soliman ma'am. Ma'am has more than 35 years of academic, administrative, and research experience in different fields of nursing profession. Ma'am has also published a practical record book of psychiatric mental health nursing, published more than 20 articles both in national and international journals. Ma'am has also the examiner, research guide, organizing of many workshops, seminars, conferences at national and international level. Ma'am has received so many awards. Out of that, 2 national awards, a leading educationalist of India and Dr. APJ Abdul Kalam Award, Friendship Forum of India in New Delhi in 20 March 2018. Second, impact of yoga and stress reduction among clinical nurses, Center of Continued Nursing Excellence, Certificate of Excellence in receiving the Asian Journal of Research in Nursing and Health, Asian Education Award for contributing to education community by Kites Craft Production, Ahilya Award for Women of Substance in Madhya Pradesh, Shiksha Ratna Award 2022, Education Icon Award, and Indian Education Icon Award for understanding contribution to society through teaching of the research. We are very happy to have you, ma'am, with us. It's our privilege to listen you, ma'am. Now handing over to Dr. Smriti Soliman, ma'am. May I request Smriti ma'am to deliver her session?
Ma'am, you can share your screen, ma'am.
Yes, sure. Going to share. उधर ही कर करो करो इसमें से कर दो, स्क्रीन पे से कर दो. ये चालू कर दिया तुमने. एक ही लेना. मेरा स्क्रीन ये नहीं चालू नहीं है ऑडियो वीडियो Very good morning to all of you, dear respected Khanna madam and all the dignitaries, and of course the all chapter 9 Indore dignitaries and executives. Yeah.
मोबाइल नंबर दिया था ना आपसे
Can you hear me?
ये है
Yes, we
नीचे वाला
can.
पहला
We can
Now
hear you.
clear? Hello?
We can hear you, no
Yes,
problem.
ma'am.
Yes, ma'am.
Yes, we can hear you.
Okay. So, very good morning to all of you and all the dignitaries on the forum, on the platform of NSS. It's my privilege to be here and join as a secretary as of chapter 9. So I hope that in future also together we are going to conduct many things and we can improve the standards of nursing, and we can work hard for to get the more and more nurses involved in this unit. So now today my topic is the topic नहीं आ रहा first slide नहीं first slide previous. Okay. So today I'm going to take some of the policies which has been taken by the government of India to for the gender equality. So now let us go with the slide. Okay. Gender equity is the 5th goal among the 17 Sustainable Development Goals adopted by the United Nations. The Constitution of India also recognizes the principle of gender equality in its preamble, fundamental rights, and under the directive principles of state policy. So our government of India has also taken some of the initiative to create gender equality. Now, National Policies for Empowerment of Women 2021 Goals and Objectives. Some of the goals and objectives I have taken because the time is very short. Number 1, creation of an environment that fosters the overall development of women and enables them to achieve their full potential. Equality to access to women, equality of access of women in healthcare, education at all levels, career and vocational guidance, employment, equal reimbursement, remuneration, occupational health and safety, and social security and public offices, etc. Ensuring equal access for women to participate in decision-making in social, political, and economic life of the country. Elimination of discrimination and all forms of violence against women and the girl child. Building and strengthening partnership with civil society, particularly women organization. So these are some of the objectives taken up by the government of India for the gender equality. Now let us go through with the major schemes taken up by the government of India for achieving gender equality in India. So number 1, Beti Bachao, Beti Padhao. This scheme focuses on ensuring the protection. Such focus. Please, आपका मोबाइल चालू है. Can you mic चालू है? Can you put it off? Okay, thank you. Beti Bachao and Beti Padhao. The Beti Bachao and Beti Padhao scheme focuses on ensuring the protection, survival, and education of the girl child. The overall goal of this scheme is to celebrate the girl child and enable her education. So the government has taken steps for the Beti Bachao and Beti Padhao. They are giving all the education free of cost in some of the state in India for the girl child. Now, next is Pradhan Mantri Mantru Vandana Yojana. This scheme aims to benefit pregnant women and lactating mothers. The scheme provides a benefit of rupees 5,000 payable in 3 installments to pregnant women and lactating mothers for the first live child in the family. So for the first live child in the family, the government provides 5,000 rupees to the pregnant mother and the lactating mother in 3 installments. Pradhan Mantri Ujjwala Yojana. The Pradhan Mantri Ujjwala Yojana was introduced with the objective to ensure the availability of clean cooking fuel to empower women and protect their health by providing free of cost LPG gas. So the government of India is providing free LPG cylinders or gas to the women. Next is Kanya Samriddhi Yojana. Now, this scheme is a small deposit scheme for a girl child in order to secure her future. The parents who have a girl child below the age of 10 years can invest in this scheme through any designated public or private banks and post offices. The plan matures when the daughter attains at the age of 21. So in this scheme, the women or the family, those who are having girl child below the age of 10, they can deposit some of the money in this, and that money will be mature at the age of 21 of the girl, and that money will be given to the girl. Now, Prime Minister Employment Generation Program. The objective of this program is to provide financial assistance to self-employment ventures in order to create job opportunities for unemployment youth and traditional artisans. And there are many young youth, they are not having jobs. So the government is providing financial assistance to them so that they can have their own business. Stand Up India. The Stand Up India scheme for financing SC, ST and women entrepreneurs aim to promote female entrepreneurship by facilitating bank loan ranging from 10 lakhs to 1 crore for setting up a greenfield enterprise in the manufacturing services or trading sector. Please, some might have opened the mic. Kindly check your mic and put it off. That will be good. So in this Stand Up India, the government, government is providing 10 lakhs, up from 10 lakhs to 1 crore of rupees as a loan to the women so that they can start up their business. Next come to the Mahila E-Heart. Now, Mahila E-Heart is a direct online marketing platform that provides technology to support women entrepreneurs to showcase the products, the services that they make, manufacture, and undertake. So this is an online platform where the females, those they are working their own, they can show their products, they can provide the services through this platform, and they can earn. One Stop Center Scheme. This scheme provides integrated support and assistance to women who have endured any type of gender-based violence, including attempted sexual harassment, sexual assault, domestic violence, trafficking, etc., both in private and public space under one roof. So this is One Stop Center is good for the women, those facing any kind of violence, including attempted sexual harassment and sexual assault and domestic violence. They can go there and they can report about the incidents that has been taken with her. Next is Ujjwala Scheme. The Ujjwala Scheme is a comprehensive scheme to prevent the trafficking of women and children for commercial sexual exploitation through social mobilization, community involvement, and awareness generation program through workshop and seminar. So the government is providing or organizing seminars and workshop in the community regarding the awareness of trafficking so that the girl and the woman can be saved from this scheme. By this scheme for going in any kind of trafficking. Women Help Scheme, Helpline Scheme. This scheme provides a toll-free 24 hours telecom services and emergency response to all women who are affected by violence and seeking support. A scheme facilitates crisis intervention through referral to police, hospitals, and ambulance. So, and women, those have gone through any kind of violence, they can take the help from this helpline. It provides 24 hours telecom services and emergency response. They provide crisis intervention. They help the woman to get the police, and they refer to the hospital, and even if they require the ambulance services, this scheme and this provide and the all sorts of help to the woman. Mahila Police Volunteers. Mahila Police Volunteers, they act as a link between the police and the community and facilitate the women in distress. They are responsible for reporting crime against women such as domestic violence, child marriage, harassment in relation to dowry, and etc. So these Mahila Police volunteers, they are responsible to report the crime to the higher authorities which has been taken place against the woman. Then a scheme for adolescent girls. The scheme covers adolescent girls aged 11 to 18 years old. Aim is to provide them education, nutrition, and health education and awareness about socio-legal issues to help them for self-development and empowerment. So this scheme will help the student, help adolescent girl for their self-development and their empowerment through or by providing education, nutrition, and health education and awareness program. Next is Rashtriya Mahila Kosh. Rashtriya Mahila Kosh is an autonomous body, a national level organization with the objective of socio-economic empowerment of women. It provides loans to NGOs and voluntary organizations which on land to self-help group of women. So the government provides loans to the NGOs and voluntary organization, and then they provide loans or help to the self-help group to develop their own or to create their own business and to earn money. Next is Deen Dayal Antyodaya Yojana. It's a national urban livelihood mission scheme. The aim is to provide shelter equipped with essential services to the urban homeless in a phased manner. The mission is to reduce poverty and vulnerability of the urban poor households by providing them with opportunity for gainful self-employment. So they provide the livelihood to the poor at the urban regions. At the same time, they help them for the self-employment also. Working Women Hostel. The aim is to ensure the safety and security of working women who are single, widow, divorced, separated, or married, but do not live in the same city or areas as their husband and immediate family, by providing them safe accommodation for including daycare, facilities for their children. So working women hostel, we know that they provide services to the working women. Those who are diverse, separated, married, but not living in a same country, same city where the family, immediate family they live. And at the same time, they provide daycare services to their children also. National Crèche Scheme for the children of working mothers. A crèche is a facility that enables working mothers to leave their children aged 6 months to 6 years in a safe environment while they are at work. It provides care services for children, daycare services for children, essential nutrition, education, and stimulating environment or atmosphere that foster their overall growth and development. So this crèche provide services to the children aged 6 months to 6 years, and there they provide a safe environment, and at the same time they provide essential nutrition, education, and a stimulating environment or atmosphere for their overall growth and development. Next is Sudhar Grah. It is a scheme for women in difficult circumstances. The aim of this scheme is to meet the primary need of the women in distress, including shelter, food, clothing, medical treatment, and care. Also assist them in regain emotional strength. It provides legal support and guidance for their readjustment in family and society, and offers economical and emotional rehabilitation. So Sudhar Grah, as we take our third year students also to visit the Sudhar Grah Women's. There they provide services, shelter they provide food, they provide medical treatment and clothing, and they take care of themselves there, and at the same time they provide emotional strength. They try to help them to regain the emotional strength in the women, those who are in distress. So these are the major schemes which has been taken up by the government. The conclusion, the government of India has implemented a range of policies, measures, schemes, and initiatives aimed at providing gender equality, empowering women, and ensuring their protection. Through continuous support and strategic interventions, these initiatives strive to uphold women and create a conducive environment for their overall development and well-being. So here we have seen the schemes which has been taken up by the government of India, and they are trying for the gender equality with all these, implementing all these schemes in India. So government, we thank our government of India also that they are promoting gender equality in India and helping women to come as entrepreneurs and helping women to showcase their work, either developing their own or creating their own business, or helping them to recruit them in different organizations. So thank you.
Ma'am, for exploring this important subject, government policy for gender equity in India. With insightful contribution from the esteemed speaker, we learned so many things about the subject. Ma'am has discussed about that Indian government has implemented the several policies to promote the gender equality, including laws, programs, and schemes. Such examples are protection of domestic violence, dowry prohibition, and vocational training also. Ma'am has also discussed about that equality of healthcare and education at all levels. Ma'am has also discussed about there's so many government policies and government helpline numbers that will be helpful to each and everyone to make that gender equality in all around the world. Thank you so much, ma'am, for helping us in deeper understanding. Thank you to everyone. Handing over to Gauri, ma'am.
Yeah, thank you so much, Sneha, ma'am.
Thank you. Thank you.
So It was a wonderful session, and thank you, Sneha ma'am, for being the moderator of the session. Now, moving on towards our session third.
One word from my side also. Congratulations,
Yeah,
Smriti
sure.
madam. Very informative session you have taken. God bless you. Keep shining. God bless you.
Thank you, ma'am. Thank you.
Thank you so much, ma'am. Now, our session third, the moderator for the session third is Professor Navneeta Krishna, ma'am. So, about Navneeta, ma'am, she is principal at Keval Shri Institute of Nursing, Indore, and NSS Treasurer, Chapter 26-27, NTA General Secretary, MP State, SOMI Active Member. Ma'am completed her BSc from Raipur and MSc from Indore, and she is currently PhD scholar from SAMES University. And in total, she is having 16 plus years of teaching experience. She has published 7 articles and research paper in national journals. Also, she is working as a book reviewer, CBS and JP Publication, and presently holding responsibility in MP State as a General Secretary, NTA, Founder President, Society of Midwifery in India, SOMI, Uttarakhand State 2017 to 23, ex-TNI Vice President, Uttarakhand State from 16 to 23. Also, she had received Best Teacher Award in Uttarakhand State by NTA in the year 2022. Lots of achievement for you, ma'am. And she is also working as a midwife consultant in Janani Jagrati Vibhag at Uttarakhand. So I request moderator ma'am to please introduce the topic and also invite speaker and introduce speaker to us also. So over to you, ma'am.
Okay, thank you so much, Gauri ma'am. And on the behalf of the Nursing Scholar Society, Begonia Chapter 9, I welcome to invite Dr. Archana Madam, Professor cum Vice Principal, SRMM College of Nursing, Wardha. Before starting the session, I would like to introduce ma'am career journey. Ma'am have total 26 years of experience as an educator, administration, researcher, and in clinical. Madam awarded by PhD in Child Health Nursing and MPhil in Health Professional Educational from DMIHER from 2014. Ma'am, under the guidance of Madam, 8 PhD awarded, and Madam is also authored 2 books, Research Methodology and Child Health Nursing First. Madam holded 12 copyrights, 1 patent applied, and Ma'am has published 3 research articles in Index Journal, WOS, Scopus, and PubMed. And Ma'am has presented paper and poster at national and international conference. Ma'am has TOT of many training program, and Ma'am have many association membership, NTAI, NNF, IANN, SOMI, and TNI. And Madam is also holding the responsibility of as inspector in a Indian Nursing Council from 2018, and Madam is also assessor in Maharashtra Nursing Council from 2024. Ma'am is also assessor in NAC 2024. So I would like to invite you, ma'am, to take the session. Very welcome you, ma'am.
Thank you, dear. So first, I thanks to Professor Navneeta. You give the very nice introductions about me. And I give the thanks also for all the dignitaries, Dr. Khanna ma'am, Dr. Qureshi ma'am, Bimla Kapoor ma'am. So, through you, I have the chance to come and speak something about the today's topic. So, share here. Okay. So now my topic is today's topic, especially for the me, this the subtopic is there, eliminating system barriers and biases, preventing women equality. So this is a very vast topic is there, but it is possible. Now, Just I start with the little introduction. So regarding that, the topic that despite the progress, systematic barriers and biases continue to limit of the women opportunities in education, workplace, healthcare, and leadership role also. So through these presentations, I explored the key barriers and strategy to promote the gender equality. Now, key systematic barriers. I've taken some few systematic barriers that can affect on the gender equality. I listed here first the workplace discriminations for the women, unconscious biases there, lack of representation, unequal access to the education for women, and healthcare disparities, health and legal and policy gaps is also found in somewhere, and cultural and social norms also. These are the common systemic barrier and biases for the gender equality. The first is, just we go a little bit in there, that workplace discrimination. We all are know now in the 1 or 2 decades before that, the number of barriers is there. And now the time a little bit it is, we improve the things. Here, the women often face unequal pay prior that, and the fewer leadership opportunities and bias for hearing and promotion also. So how we overcome all these things? The number of policy already the Madam Smriti ma'am is already taken the policies and all this, but here just we get list out the how we address the workplace discriminations. So the first is, when we plan the strategy, the pay transparency and the equal pay policy it is required. My voice is audible, please?
Yes, ma'am. Yes, ma'am.
Yes, ma'am. Yes, ma'am.
Thank you so much. Thank you so much. That here, when the pay transparency and equal pay policy is there, that time we can work close discrimination. We reduce the things that the company means work, college, school, organization should conduct the regular salary audit. It is important to identify the close gap and the implement policies and ensure fair that the transparent salary and structured salary it's required for the employer. So this is the one means strategy. Next is the mentor and sponsorship for the women is also important. It is going on, but it is important point that encourage the leadership program that support women career growth and provide the mentorship and sponsorship opportunity to help women in advance. They can improve herself. Then the next is the flexibility in the policy and supportive workplace culture. This is also very important for the workplace discrimination, reducing that. Here, the implement family-friendly policies like the pay, maternity leave, and flexible work. Work is in progress, but we can pay attention on that particular point also. Then encourage to cultural where the work-life balance and respect to all employees. This is also important. The next is promote the women in the leadership. This is very important because here, everywhere that they do the work, the contribution is there, but the problem is there, we get now the time empowerment is there, the women empowerment. So they set the diversity goal for the leadership positions and create the pathway for the women and move into the role through the leadership development program. So this is we can conduct in the workplaces for the women. Now the second point is biases come the unconscious bias. The unconscious bias is always the bias refer to deeply stereotype of attitude of the persons that influence the decision making without individual realization. We see in our surrounding these common things. We see this is the unconscious biases. These biases affect the hearing, promotion, leadership opportunity, workplace culture, and opening, putting the women in disadvantage. So we can reduce these biases. So eliminate the unconscious bias in the workplace. So the main things is there, be aware and educate the women's. So biases training program, we provide the training program to them, implicit that the bias testing and open conversation is also important in the workplace. Then the another is including the hearing and promotion practices, blind recruitment, it is required, structured interview is required, and clear promotion criteria. I think now most of the institution, most of the colleges, organizations, they have the clear promotion criteria, structured interview. So we can resolve this problem slowly. Then changing the workplace culture, when leadership, mentorship, sponsorship program, and challenging for the stereotype of attitude. Also, it change. These are the challenges. Performing evaluation without bias. When we perform evaluation of the any female or the male, any person is there, that time always we use without bias. So objective criteria to review awareness in feedback, the structural feedback also. Then work-life balance and flexibility, the equal parental leave policy, flexible work arrangement, it should be equal for both. Then accountability and continuous improvements, under that the diversity matrix and audit. This is important, and bias interrupt that strategy and leadership committee. So ensure that execute that manage actively promote the inclusively and diversity. Now we come to the third one, lack of representation. We see everywhere the woman is there, they do the work very nicely, but somewhere the lack of representation is there. The women are underrepresented in the leadership role, especially. But now, today we see the number of leaders is there from this one leader, but till now, this gap, it is not fulfilled properly as per the, if we can compare with the male. That here, especially the policy STEM field, yani science, technology, engineering, maths, these fields at the decision-making positions due to the systemic bias, the social norm, that the historical inequality is there. So to close the gap, and organization and growth, government must take the proactive steps to create the equal opportunity and support the women in the advancing. So how we can this one improve the representation of the women? Some strategies is there. Increase the access to leadership opportunity. We set the delivery goal, diversity goal. Promote the from within the create leadership development program in the organization and be contribution as a nurse, means woman as a nursing both. Then improving the hearing and promotion practices. Then diversing the hearing panel, blind recruitment, it is required in the process, and transparent promotion criteria also is important. Already we discussed in the previous slide. Standard criteria is required. Then strengthen through the mentorship and scholarship program, sponsorship programs. So it's help to the women for reducing the or improvising the representation. And the blind and inclusion the workplace culture also eliminated the workplace biases. Then government and policy supporter, the gender codes, that the leadership quality and equal pay, anti-discrimination law, then support the movement, own business also. So these are the contributing or strategy to improve the representation of women in the worldwide. Now the equal access of the equal access to education, this is also the one barrier. Now the time this much is improvement is there, near about the 50 to 60-70% improvement, but till now we can come or achieve the outcome at the top. So here the many part of the world, the girls still have less access to equal education compared to boys. The girls still face the barrier in the education due to the poverty, the number of things are there, number of what we say the biases are there, cultural norm is also there. then early marriages, lack of school, and gender biases. All these things create unequal access the education for the girl child. So we have some strategies eliminate the unequal access to education. So address the financial barrier. This is the things are to provide a free or offered education. Now in India, they give some free education to the all, maybe the boys and girls, and especially girls. Now the one slogan is there, Beti Badhao, Beti Padhao, the slogan. So scholarship, then the financial aid, and case transfer, just one. Case transfer programs, all these things we included in the financial barrier. So we reduce that financial barrier and we overcome for the unequal access the education. Another is the cultural barrier is also there. The cultural challenges, this can norm and the gender based. That the community awareness program is important. Religious leadership and child marriages, gender bias, all these things we can reduce through the awareness program. Also, policy is there, but awareness program it is required. Then this is very important here for the unequal access to education. That one, improvement of the school and infrastructures and safety of the women or girl child. That the build more school in the rural area. Now the till date, in the rural area, they are not assessing the advanced educations in that field, that place. So safe transportation, it is also very important. Then the separate sanitation facility is very important for the girls, childs during the educations. Increase the female teachers for role model, especially. They recruit the trained and female teachers to leadership and mentor program. So it's inspired to the children's also, inspired to the girls also for overcome. And when they see that they are more role models, then make the education gender exclusive, revise school STEM programs and girl flexible learning opinion. Then the strength government policy and the global support is also important. Enforcing the education law, international support, funding, workplace, and the career development. Now we come to the healthcare disparities. In the healthcare disparity, the ones I given the one image, he has provided the one image. Under that, the first in the health male, then come in the female at the end. So this gap, it is filled by the some strategies is there. That means the health gap. This is very big gap in that, but now the time it is improved or the gap it is fulfilling in the improvement. That the women health concern often the overlook into the underfunding medical researches. But now in the previous speaker, this is the number of things are there for the research, medical research and funded research also available. So the women face the health disparity due to the gender bias and medical research unequal access for the health services and the social and economical inequality. These disparity affect on the disease diagnosis, treatment, overall growth or the health development. So eliminating these gaps require the systemic reform, better policies, awareness, and ensure the women receiving the healthcare equally. These are the points. Just I give the just listing here that the address the gender bias, medical research treatment, increasing the women focus on the research, improving the clinical trial diversity, and trained healthcare worker or healthcare provider on the gender bias also. The improving access to the affordable in the quality healthcare. This expand the universal or healthcare coverage, provide the free or low cost maternal reproductive care. So government scheme is there and it is implemented, and increasing the funding for the women health clinics also. Then strength education awareness, then improving the maternal health and reproductive rights, add the social determinants for the health, and here that tackle the economic improvement, improve the nutritional wellness program, and increase the mental health also included in this. That the healthcare disability. The policy and legal reform is also important to strengthen the anti-discriminating policies in the healthcare, increasing the government and private sector to ensure the rural and under-reserved area have been equal access for that the healthcare. Next is legal and policy gap. Here, just I give very little because the already policies legal means already told by the another speaker. So laws and the policies sometimes fail to protect the women's rights. So such those related to maternity leave, workplace, and gender-based violence is there. So some strategies is there. So for that, the strengthen give to the maternity and leave for the workplace protection. Now, I think the improvement is there under that, the mandate the paid maternity leave, then parental leave, and enforcing the workplace anti-discrimination law and provide the child care support. And enforcing the strong law against the workplace harassment also important here. That in the past system, anti-harassment, mandatory, ICC things are there, ICC committee is there. Then forum, women forum here, we can complain on that. Then strength law against the gender-based violence. Here, ensuring that the strong domestic violence law provide the protection order and support services, and criminalizing the marital rape and the strict penalties for the sexual violence. Then the next is improving the legal access and awareness for the women about the legal aid services for the women. And strength equal for the payroll, already we discussed in the previous slide, improving the policy, implementing the accountability. So independent oversight body increasing the women for policies, and periodic policy review is also important. Then the cultural and social norm. In the cultural social norm, we all know the thing deep ingrained that the societal norm often that the limit women's choice freedom and economic dependency. These norms can be the manifest in the expectation about the gender role. So restriction on the education, work, biases, we all know the things we play the multitask. The women are the multitasker. They play the role at home, the vital role in the college, in the hospital, everywhere, in all the places. So promote the gender equality. For this is the same thing is there. Ensuring or engaging the community to challenge stereotype of attitude those are having, we can reduce the things. Then support the women economically empowerment. This is the very important key for that. We can reducing the things there, encouraging the women for entrepreneurship, eliminate the workplace discrimination, break barriers and male dominant field also. Thank you. Next is end harmful cultural practices. We can also reduce that one, ban the child marriage, the act is there, so no problem now that time, but we can pay attention on this, promote the legal reform, gender-based violence and awareness about the reproductive rights. Then increase the female representation in the leadership and media. So encourage the women for the policy and the leadership. Then legal protections, already in the continuing same in all the slide I given that so legal protections, the implementing, enforcing gender equality and law provided legal acts and support for encouraging the male equality. Now we come to the conclusion. So it is not the end of this, but we conclude the things, the eliminating systemic barriers and the biases that prevent the women equality, not just for moral impact, but it is also the step forward toward a more just and prosperous society, achieving the true gender equality, that the demanding that discriminating policies, addressing unconscious bias, already the number of biases there we can see, and by implementing the stronger legal protections, advocacy and equal opportunity, and promoting the cultural shift challenges, we can reduce the stereotype of the attitude, and we can give the good workplace or equality for the women. And the theme of the Women's Day, it is elicited the action in the worldwide call for acknowledge STEM resources and actively that positively impact of the women advance and support to elevate their implementing through reducing the biases and through give the strength to the women. So from my side, some of the things. But if anybody want to say anything on that, please welcome you. If you want to ask any queries, so I will able to give the answer. If not, so our mentor is here, they will reply you. Thank you so much.
Thank you, ma'am, for wonderful presentation taken by you. And it was very knowledgeable session for all of us. And the topic is also very burning topic when we will talk about the women. And ma'am has explained about many barriers in there and lots of discrimination still happening in India. So we need to create awareness and stand it, also putting women in leadership. And madam has explained 12 barriers, bias, and very well explained, ma'am. Thank you so much, ma'am, for giving us time.
Thank you, ma'am. Thank you.
ma'am.
Thank you so much.
If any add the seniors, leaders,
Yes, ma'am,
if you want
please.
to add anything.
मैं मांगती हूँ मैडम
Yes,
अर्चना
ma'am.
जी, आपने
जी।
बहुत सुंदर प्रेजेंट किया,
Thank you so
बहुत
much.
प्यारा. गॉड ब्लेस यू बेटी, गॉड ब्लेस यू.
Thank you, ma'am. Thank you so much.
Thank you, ma'am. Gauri, ma'am, over to you, ma'am.
Yes, ma'am. Thank you so much, ma'am, for moderating the session, and thank you, speaker ma'am, for providing us with the knowledge. So with this, we come to the end of our today's Women's Day celebration. So on behalf of the organizing team, I am honored and privileged to extend my heartfelt thanks to all those who have been contributing in making this NSS Chapter 9 Begonia Indore Women's Day celebration an inspiring and meaningful event. First and foremost, a special thanks to our distinguished panel of eminent personalities who have graced us with their presence today. I would start with our chief guest, Dr. Khanna ma'am, founder president NSS Society, whose unwavering commitment to women's empowerment has inspired so many. Your words today were truly motivating and thought-provoking. Thank you, ma'am, for sharing your valuable insight with us. I thank NSS leader Dr. Bimla Kapoor, ma'am, for being here today. Your contributions in nursing have made a significant impact on the advancement of women. We are deeply grateful to NSS leader Dr. Asha Qureshi, ma'am, as your words today have reminded us all of the importance of perseverance and unity. We are also deeply grateful to our guest of honor, Dr. Binu Joy, sir, for your presence and the wisdom you have shared with us today. My sincere gratitude to Professor Anujoy Kuti, ma'am, for your ongoing efforts in shaping a better future for nurses everywhere. Special thanks to Muthu sir, as your presence is a testament to your dedication towards the NSS and creating opportunities. My thanks also goes to all the awardees for accepting our award with dignity and grace. To all the attendees, thank you for your participation and enthusiasm. This celebration is for each and every one of you as we come together to honor the strength, resilience, and brilliance of women around the world. Last but not the least, my deepest appreciation goes to the organizing committee members, Dr. Maya Patlia ma'am, Dr. Prerna Pandey ma'am, Dr. Smriti Solomon ma'am, Navneeta ma'am, who worked tirelessly behind the scenes to ensure this event was a great success. Once again, thank you to everyone for making this Women's Day celebration truly special. May we continue to strive for a world where equality, respect, and opportunities are available for all women everywhere. Thank you, ma'am, and have a wonderful day ahead.
Thank you, ma'am. Khanna, ma'am, anything you want to say? Khanna, ma'am, anything you want to
Please
say?
unmute yourself. Unmute yourself, ma'am, please.
Looks like I was talking to myself.
Yes, ma'am. Now you can talk. It's audible, ma'am.
I'd like to thank especially both of you for your wonderful MC. The way you have handled it in all these crises when we couldn't even get connected. And finally we did, and it was superb. Very nice to both of you. And good night or good morning, good afternoon. Whatever you want to do is next we do if informal, one photo. Everyone, if you can take or do something, that will be great. The group photo that everyone comes in, whosoever is present there. Muthu sir, are you taking it? Yes, Mayaji is there. I don't see Vimla. Yeah,
Yes,
as many as can come in the group will be wonderful.
just please put on all videos, no? All of you, please put on videos, please. Yes, ma'am, I'll take.
Yeah. Then put it down and I will take you in when you finish.
Yes, ma'am.
Yeah. Smile. Wonderful. Thank you and thank you and thank you, Khushi. I'm proud of you. Did a wonderful job.
Thank you, ma'am. Thank you,
Yes, sir.
Muthu sir. Especially thank you because you are support a lot, sir.
It's my pleasure, ma'am, always. Whenever there is a problem, madam will give me a call.
Yeah.
Muthuji, you should do
And
this.
Sana ma'am, please, thank you so much. And whatever we have did because of you only, ma'am.
No, we wouldn't have been here if you were not taking interest and initiative. So pat on your back.
मैं भी एक शब्द बोलना मांगती खन्ना मैडम, आपको सैल्यूट, बहुत गाइड करते हैं और एनकरेज करते हैं। हम लोग तो घबरा गए थे, पर आपने बहुत गाइड किया। थैंक यू, गॉड ब्लेस यू। और खुशी बेटा भी बहुत बहुत धन्यवाद। इतनी प्यारी सी बेटी ने हम सबको बहुत मोटिवेट किया। गॉड ब्लेस यू एवरीबडी एवरीबडी। प्रेरणा मैडम, स्वीति मैडम, जितने भी बैठे हैं, हमारी बेटी और स्नेहा बेटी, सब लोग बहुत बहुत आशीर्वाद। थैंक यू।
Take another picture. Asha ji is there.
Yeah, I'm here. I just went to the washroom.
That's all right. Take your.
Yeah. Very well done. Very well organized. Very well done. Speakers, brought very good knowledge, government policies and all about women empowerment and women equality and rights and all. So we all have to be together to initiate action. This is time to initiate action now. We know all these things. From ages we are learning, hearing that. But initiating the action is now most important.
Wonderful. Accelerating. Well, you all are invited at international chapter where Asha ji is president, March 30th. Please come all and attend on Zoom. Just it is a moral support to each other chapter. What we are doing it is not for only that state or city, but it is for all of us. I am thankful to our Secretary General and Dr. Alka Tajneji. I saw her most of the time here. And Dr. Bimla ji, is she still there, Alka ji?
Yeah, she is there.
Yes, ma'am. Yes, ma'am. Yes, ma'am.
Say something then. Come on, come on. Please.
Good morning, everyone.
Good morning.
Congratulations to all the awardees. And today's session was, yeah. Yes, ma'am.
So proud of all of you, pillars of this NSS. Just the conception doesn't work unless there is implementation. And each one of you are going extra mile to say something, to do something where we can be together. And this crisis came, even my son, he said he never had this problem. It had to be today on Women's Day, and that happened, right? It is such a thing. He usually talks to all those, his clients, he's a lawyer, and talks to all other countries. He said it never happens. Why this Zoom has to say no access to USA today? I said, your president, I'm not for, but he's on that part. I said, your president did something, Donald Trump. So we are out.
Yeah. There is some update, they are doing some update in the Zoom.
Acha ji,
You know?
acha. It's
Yeah,
not over.
yeah. Dr. Muthu, I just request you, I will send you the PPT and you have to help me little bit. Okay?
Yes, ma'am. Surely, ma'am. I'll help.
I will send you a few of them, like making the poster and all
Sure,
those
sure,
things
sure.
and all. The rest of
Sure,
it I have
ma'am.
done
Sure,
it.
ma'am. Sure,
And some
sure.
of it I will take your help.
I
Okay?
need to appoint him as
I think you won't mind. And of course, as usual, Dr. Khanna will
No, I'll
edit
do
it.
it.
No, editing is all right, but I'm saying I have to appoint him specially for this job because twice in a day in 24 hours we are making and correcting it for 2 hours. So I'm going to sleep all day tonight and tomorrow, and then I will be all right. But anyway, thanks to each one of you. So my Betty Alka ji, good
Thank you
night.
so much, ma'am. Okay, good night, ma'am. Good night.
Okay. Okay.
Good night, ma'am.
But Sweta, I see Dr. Sweta now. New
I
member.
wanted all of you to unmute your video so that I can click one picture because only
Yep.
names
Yes.
are coming. So please, unmute yourself.
Who's put on video?
Not everyone. Previously, also I wrote in the note, but not everyone has put on the video. Please, all of you, please put on the video.
Thank you.
Thank you.
Navneeta ma'am, sorry, actually yesterday night I disturbed you a lot. Actually, even as same Khanna ma'am also repeatedly I'll be calling Khanna ma'am and Navneeta ma'am to prepare this
It's
PPT.
okay, sir. It's okay.
I'm extremely
It's our
sorry for that.
job.
Actually, late night I have disturbed you.
No, sir. It's okay, sir.
So that ends well. It worked out. Whatever happened. And Navneeta ji pulled it all together, all the strings together and played them nicely. Very nice.
Thank you, Khanna madam. Thank you, Qureshi madam. Thank you, Muthu sir. Everybody, thank you very much.
Such a beautiful
Thank you, ma'am.
God bless you. God bless
Because of
you all.
support
God
of
bless
you
you all.
all, this webinar is successful. We made it
It is
successful.
our
God
first
bless you.
activity, ma'am.
Thank
Yeah.
you, Navneeta.
No, Navneeta is very lucky to have you. Oh my God. When she said Dr. Smith is coming, she's so gullible. She is our member also, and she doesn't know double pay and all that. But thank you. Thank you for coming in our
She is
chapter.
our real inspiration,
And very
She's
smart.
we are really proud of you.
Maya, Dr. Maya Patlia, finally, she was writing me in the middle of that.
Yeah,
She
madam
can
is there, ma'am. My madam is there.
just take picture with her. I don't think she was in
No,
one
she's
of the.
there, ma'am. She's there. Ma'am, Maya, ma'am, madam is asking, ma'am. Just say hi.
If she for a minute she can come in and we take a good picture. And Gauri was here. Where did she go? So as many
Ma'am,
people.
I am here only.
Stay.
Gauri ma'am also is here. She's there.
Only I'm missing Bimla ji, but that's okay. Is she coming, Maya ji?
Vikas Kumar also have to come. Purnima, Anusha.
Yes, ma'am, you
Yeah.
can go ahead. I can unmute. You can go ahead, ma'am.
नहीं, मैं फिर से एक बार धन्यवाद दे रही हूँ आप सबको और आयशा मैम के लिए भी इतना सुंदर, so well encouraging. Everybody who achieved award, my blessing to everybody, and all. I have no words to express that this conference becomes so successful. God bless you all. Thank you, ma'am.
Wonderful.
It's your hard work,
No, this little children now, they are so kind and very
Everyone's,
precious.
yeah, it's a teamwork,
It's a
I
teamwork.
didn't like anything, and they were bearing me. Thank you.
Thank you. Okay, ji. Final good night and bye.
Good night, ma'am.
Thank you,
Good
ma'am.
night.
Thank you. Thank you, ma'am.
Vikas Kumar has
everyone,
opened
once
her
again.
video now.
Yes, ma'am.
Okay,
Ma'am, what is
thank
the
you so
time, ma'am,
much.
now?
Sabko
Okay, ma'am.
namaskar and God bless you. Have a good day.
Ashiya ma'am, what is the
Madam,
time now?
have a good night.
Ashiya ma'am, good day.
Thank you. Thank you. Thank you, Alkaji.
Thank you, ma'am. Shall I end it, ma'am?
Yeah, I think we should do that.
Yes, madam. Thank you. Thank you, all of you.
Bye-bye.
Thank you so much.
Thank
Have a
you.
wonderful day.
Bye,
Thank
everyone.
you.
Thank you, sir.
Thank you, everyone. Have a
Thank
good
you.
day.